If you've been experiencing joint pain and wondering whether it could be something more serious, this video is for you. Many people assume joint pain is simply due to aging, exercise, or wear and tear. And sometimes that's true. But in some cases, joint pain can actually be a sign of an underlying autoimmune or inflammatory condition. The challenge is that autoimmune arthritis is often missed early on because the symptoms can start gradually and may not always look dramatic at first. In this video, I'm going to explain 5 important signs that your joint pain could be autoimmune, what autoimmune arthritis actually means, and when you should consider seeking specialist advice. I'm Dr Naveen Bhadauria, consultant rheumatologist at Pure Rheumatology, London. Let's start with the basics. What does autoimmune actually mean? Autoimmune disease occurs when the immune system becomes overactive and mistakenly attacks the body's own tissues. In rheumatology, this often affects the joints, but autoimmune conditions can also affect the skin, eyes, blood vessels, muscles, lungs, and other organs. One of the most common examples is rheumatoid arthritis, but there are many other autoimmune conditions including lupus, psoriatic arthritis, Sjögren syndrome, and inflammatory spinal arthritis. Now let's go through the 5 warning signs. The first sign is prolonged morning stiffness. This is one of the biggest clues that joint pain may be inflammatory rather than mechanical. With wear and tear arthritis, people often feel stiff briefly after resting, but it tends to improve fairly quickly. Autoimmune arthritis is different. Patients often describe waking up feeling extremely stiff for 30 minutes, hour, or sometimes even longer. Some people say they struggle to get out of bed, make a fist, or walk normally first thing in the morning. The stiffness often improves gradually with movement. That pattern is very characteristic of inflammatory arthritis. The second sign is swollen joints. Inflammation inside the joints can cause visible swelling. Patients may notice puffiness around the fingers, wrists, knees, or other joints. Sometimes rings stop fitting properly. Some patients notice warmth or tenderness around the joint as well. Now, swelling does not always mean autoimmune disease, but persistent swelling, particularly involving multiple joints, is something that should not be ignored. The third sign is fatigue. This is an extremely important symptom and often underestimated. Autoimmune diseases do not just affect the joints, they affect the whole body. Inflammation can lead to profound fatigue, poor concentration, and low energy levels. Many patients tell me, I feel exhausted all the time, or I just don't feel like myself anymore. This type of fatigue is very different from normal tiredness. It can feel overwhelming and persistent. If joint pain is associated with significant fatigue, that raises concern for inflammatory disease. The fourth sign is symmetrical symptoms. This means the same joints are affected on both sides of the body. For example, both hands, both wrists, both knees. Rheumatoid arthritis often affects joints symmetrically. Patients may notice pain and stiffness affecting both hands or both feet at the same time. This pattern is less typical of simple mechanical wear and tear. Now, this is not an absolute rule, but it can be an important clue. The fifth sign is associated autoimmune symptoms. This is where things become particularly important. Joint pain associated with other symptoms may point towards a systemic autoimmune condition. Examples include skin rashes, psoriasis, dry eyes, dry mouth, mouth ulcers, Raynaud's phenomenon, unexplained fevers, weight loss. For example, psoriasis together with joint pain may suggest psoriatic arthritis. Dry eyes and dry mouth may suggest Sjögren syndrome. Rashes and fatigue may raise concern for lupus. Raynaud's, where fingers change color in the cold, can also be associated with autoimmune disease. So it's important to look at the whole picture, not just the joints themselves. Now, one important question patients ask is, can autoimmune arthritis start gradually? The answer is absolutely yes. Many people imagine autoimmune disease begins suddenly and dramatically, but often symptoms develop slowly over months. Patients may initially dismiss the symptoms as stress, aging, overwork, or minor injuries. This is one reason diagnosis can sometimes be delayed. Now, another important point is that autoimmune arthritis can affect people of all ages. It is not simply a condition of older adults. I see patients in their 20s, 30s, and 40s with inflammatory arthritis. So younger age does not exclude the possibility. Now let's talk about why early diagnosis matters. Inflammatory arthritis can potentially damage joints over time if left untreated. But the good news is that treatments today are far better than they used to be. Early diagnosis and treatment can significantly improve symptoms, reduce inflammation, and help prevent long-term joint damage. This is why recognizing the early warning signs is so important. Now, what should you do if these symptoms sound familiar? The first step is not to panic. Many causes of joint pain are not autoimmune. However, if you are experiencing prolonged stiffness, swollen joints, fatigue, symmetrical symptoms, associated autoimmune features, then it is worth discussing this with a healthcare professional. Blood tests may be helpful in some cases. These can look for inflammation or autoimmune markers. Imaging such as ultrasound or MRI can sometimes detect inflammation early, but diagnosis is based on the overall clinical picture rather than one single test. Now, another important point is that autoimmune blood tests are not always positive. Some patients assume that if blood tests are normal, autoimmune disease is impossible. That is not always true. Certain inflammatory conditions can still be present even when standard blood tests are negative. This is why clinical assessment remains very important. Now let's briefly discuss some of the common autoimmune conditions linked to joint pain. Rheumatoid arthritis commonly affects the hands, wrists, and feet. Psoriatic arthritis can affect joints and tendons and may be associated with psoriasis. Lupus can cause joint pain alongside fatigue, rashes, and other systemic symptoms. Inflammatory spinal arthritis often affects the lower back and causes stiffness that improves with movement. Sjögren syndrome may cause joint pain together with dryness and fatigue. Each condition behaves differently, which is why accurate assessment matters. Now, another thing patients often ask is, can stress cause autoimmune disease? Stress itself does not directly cause autoimmune disease, but stress can certainly worsen symptoms and flare-ups. Living with chronic inflammation can also affect emotional well-being, sleep, and mental health. So managing stress is an important part of overall care. Now let's summarize the key warning signs again. The 5 signs your joint pain could be autoimmune are prolonged morning stiffness, swollen joints, significant fatigue, symmetrical symptoms, and associated autoimmune features such as rashes, psoriasis, dry eyes, or Raynaud's. If these symptoms sound familiar, it's important not to ignore them. Early recognition and treatment can make a major difference to long-term outcomes and quality of life. If you found this video helpful, make sure to subscribe for more content on joint health and autoimmune disease. And if you're concerned about your symptoms or would like a specialist assessment, I see patients at Pure Rheumatology London. Details are in the description below. Thank you for watching.